Well, the health of children today doesn't compare as favorably as it did in the previous generation. Children today are heavier, more sedentary, and are at risk of developing chronic diseases as they get older.
In Nova Scotia, we have higher rates of chronic disease, we have growing rates of obesity. Collectively, we become physically inactive and we eat generally unhealthy diets. And that's creating a whole range of health issues in children, in adults, and younger and older adults. Higher rates of chronic disease, early onset diabetes, a whole range of things, mental and physical health that we really need to pay attention to.
The reality is, we have some challenges with the health of our children. We're seeing obesity rates that are, doubling and tripling. We need to ensure that we're getting them on the right track, that we're getting them on a healthy lifestyle that's going to allow them to have a successful future.
Government has a role in setting policy. Policy, and particularly public policy, has an impact on changing behavior. It may have impact particularly with respect to the foods people select, the kinds of things that they're incented to choose when they go to buy food. It may be with respect to active transportation, for example, making sure that communities have the incentive to develop walking trails, biking paths, close proximity to shopping or to access of other services, including doctor's offices and things in the neighborhood.
So if we say, I want to be more active, I want my family to be more active, is it easy to do that? Do we have sidewalks in our communities? Do we have easy, affordable access to healthy, nutritious food?
We definitely need to and can approach this through collaboration, building on existing good work going on in the community now.
Well, government can make a difference, of course, by supporting all of those initiatives and by ensuring that we're working with schools, that we're working with volunteer organizations, that we're working with groups who are actually already promoting healthy lifestyles. And we want to ensure that they have the support that they need so that children are given the opportunity to have a successful, healthy life.
Thrive is part of the plan to help Nova Scotians collectively to be healthier. It's really providing the leadership to bring communities, bring businesses, to bring us all together to talk about and implement things that are going to make it easier, again, and build our community so it's much easier for all of us to be healthier.
We need to look at ways to actually cross different sectors of society. So recognizing that health actually has benefits in terms of educational achievement. Children who are well nourished and who are physically active are more likely to learn better, and that has an impact on then our economic development. So again, you can see that we can connect all these dots, so connecting health with education, with economic development is a clear example of how health can actually have an impact in many other areas.
Physical activity is really important. Wellness of health, wellness of mind, state of mind, ability to be able to interact with other people. It affects your mood, it affects whether you're happy, whether you're sad, especially with young kids. So really starting with a younger age group and teaching them that physical activity is important. By the time they're older, it will be just a part of their lives.
The benefits are many. It means that young people, they're going to have a better experience through the education system, they're going to be more successful, and they're going to have better, healthier lives.
We'll have a healthier future, a healthier economy, and something to look forward to. And it will cost us less in the long run to look after our people.
I think that healthy living will become the norm. In 20 years, children will look back and say, I'm living a better life today because of the changes that my parents, that the government, the community organizations made 20 years ago.